Hey, it's Dr. Charschan. I wanted to cover one of the most common things we see in the office, and that's shoulder pain. And a lot of people have misconceptions. It's interesting to hear people talk. Oh, it's just a shoulder problem. Oh, it's rotator cuff. Oh my God. It's the same thing. The rotator cuff is the shoulder, but the shoulder is affected by a bunch of different things. Now, the most common reasons that somebody will see a professional for a shoulder problem might include a tear, impingement, frozen shoulder, which is when it gets really bad, and a shoulder strain, which could happen from anything from a fall with an outstretched arm or maybe repetitive. But the problem is, why is the shoulder problem occurring? So, and what works to relieve it? So the thing is that there are things that could offer temporary relief. A lot of people will go in and they'll have a shoulder problem. They'll see a primary doctor. They're not really too adept at looking at this, and they'll send you to a specialist, usually an orthopedic, and the orthopedic looks at the shoulder, he takes x-rays, or he might do some other tests of the shoulder. What about the rest of your body? Well, if you've ever seen a shoulder walking around in the park, please let me know, because I've never seen one in the wild. However, I've seen people that happen to have shoulders. So if you're not looking at the whole person, you're never going to figure out what's going on with the shoulder. So the thing is that if you get an injection, it might offer temporary relief, or maybe not. If you go for rehab, if they're doing things to the shoulder, well, why did the shoulder go bad? Well, if it's exercise, doing more exercise might actually aggravate it. So we got to look at the shoulder as part of the body. Now the thing is, it's very important to have good posture. If you have a posture where the shoulders roll in like this, there's a very good likelihood that you could develop an impingement. There's also a very good likelihood that you might have other issues going on there, including problems in the feet. If you look down, you'll see what I'm talking about. So if we're not looking at this, if we're not looking at the pelvis, which is up in here, if we're not seeing the pelvis to see if it's level or if it's distorted, which will conversely create a distortion in the upper back and restrict your movement by bringing the arm up in here, over time, that's going to go ahead and cause problems in the shoulder as well. So we need to really look at all these different things. Okay, so the lower back will affect the shoulder. Common conditions often affected with the shoulder might include, say, a hip capsule issue, a foot issue, foot problems. A lot of people come in and they say, well, I have a shoulder issue. And then you question them, well, I also have sciatica. I also have this. So we ask about everything. That's called being holistic. That's called being thorough. So it's really a movement problem. And when people have a frozen shoulder, what usually happens is they're already restricted. They maybe weren't in pain before, and now they go reaching out. Now they're in pain. So who should you see first? Well, the chiropractor is probably your best bet. Because why? Because we're primary care for musculoskeletal. We're the one-stop shop. We'll take a look at everything. We'll look at your feet. We'll look at your legs. We'll have you squat down. We'll take a look at other parts of the body. We'll be able to trace the restrictions in your shoulder to maybe another part of the body. And more commonly, a shoulder problem that's chronic will also have other things going on in the other parts of the body. So it's important that you look at people first. So the chiropractor is really probably your best first person to see for a shoulder problem. Our goal is your goal: pain relief and a return to normal function. So who should you see first for a shoulder problem? Well, chiropractor, naturally. And you can feel better in as little as one visit. Call us today. You have nothing to lose but your pain.